there was a group of nurses that you were working with and women who were helping bring all of this out to the public. Remind me, what was that group called again? I'm sorry.
That's okay. No, and the group is still going. It's the Cannabis Nurses Network. And
right.
We did establish in 2015, and it keeps growing and getting stronger because as nurses, we're really the ones on the front line seeing patients who are many times will tell a nurse that they're using cannabis even before they'll tell a doctor that they're using cannabis. And so we find ourselves in this position as knowledge holders. And it's a huge responsibility because how do we as nurses speak with patients? How do we, and one of the things I've found over the years, it's literally been 14 years of working with cannabis patients. The majority of patients just want to know that it's okay. They're seeking permission from a medical professional to explore these options. And I find that it makes our jobs as nurses a lot easier when patients are utilizing cannabis because it's so beneficial for so many things. So it's really fascinating. And I don't know if you're aware of Ryan's Law. Have you heard about Ryan's Law here in California that got passed last year?
No.
So what our group has been working on since 2018, I guess it was, we've been working on getting this legislation called Ryan's Law passed. And the first year in 2019, we put it through and it received bipartisan support. And what Ryan's Law is a law that mandates that hospitals and healthcare facilities allow cannabis patients to use their cannabis, terminally ill patients to use their cannabis while they are receiving inpatient care. And it made it all the way through bipartisan, unanimous votes all the way till it got to the governor's desk. And in 2019, he vetoed it. So obviously 2020 happened. We had submitted the bill again. We pulled it because it wasn't going to do anything. But in 2021, we put it through again and it made it all the way to the governor's desk and he signed it in September of last year. So as of January 1st of 2022, patients in the state of California who are terminally ill have the right to use their cannabis as they choose without, short of smoking. You can't smoke or vape inside the facility, but they're able to use cannabis like they would use it at home if they're needing to receive inpatient care. And I say all that to say this. This is the next step in patient access. And this truly is the first step in bridging this gap between cannabis medicine and the healthcare system. And we're, as a network, going back to the Cannabis Nurses Network, we are driving this in other states now. And very, very interesting stuff. Very, very
It's pretty amazing because what was his reason for vetoing it the first time?
Great question. The reason he vetoed it was because the hospital association had gone through the back door and said, we're gonna lose our Medicaid and Medicare funding. And so he wrote a letter and said, this is why I vetoed it. So what we did was went to CMS, which is the Centers for Medicare Medicaid Services. And we asked them, have you ever withheld funding because a hospital or healthcare facility allowed patients to use cannabis? And they said no. And it's all in writing. It took them about a month and a half to get back to us. But once they sent it in writing, they said, no, we have no interest in that. We've never done that. And we don't intend to do that. And so the governor signed. And we're looking to have at least 2 or 3 states add Ryan's Law in next year in 2023. So it's really, really exciting to start to see this transition of cannabis medicine really being part of the healthcare system now.
And who is Ryan?
So Ryan, his dad was the former mayor of Santee, and his name is Jim Bartell. And Ryan was his son. And he was in his 40s, and Ryan was known as the autism whisperer. He worked with children with autism, and he was diagnosed with pancreatic cancer. And if you know anything about pancreatic cancer, it's by the time you realize that you have it, because it's very asymptomatic, by the time you realize you have it, it's usually gone to the higher stages. And so that was Ryan's case as well.
Mm-hmm.
And we were trying to, the hospitals were putting him on a lot of fentanyl, and he couldn't be awake to be with his family, to interact with his young son, to talk to his friends and his wife and his parents. And he asked if he could use cannabis, and the first hospital said no, they didn't let him. And so we found another hospital that he could be in, and he was able to use cannabis, not fentanyl. And he was awake, he was alert, and able to spend those last few weeks of his life present for his family. And it was really a gift to him. And his dad, Jim, after Ryan passed away, said, I really want to pass a law in his honor so that no other patient will go through what Ryan went through, which was a couple weeks of transition where he couldn't really be present with his family. So it's a beautiful thing, and I'm really excited to see it happening.
So this will also happen in hospices as well for end of life?
Absolutely.
Wow. And who is there a rule that where the medication comes from, or is it patient family provided?
That's it. And so we were really particular when writing this law that we wanted it to be about patient empowerment, allowing patients to make their choices. And so, yes, the patient or the family would be bringing it to the hospital. And we're here in California where delivery happens. So technically, a patient could literally get a delivery to a hospital or hospice or healthcare facility, and they're in control of when they take the medicine, how. Obviously, they'll be issued a lockbox so that they can keep it in their room locked up and safe. But we did a really good job of eliminating healthcare provider interference, pharmacy interference, just because what we know is that healthcare providers aren't that knowledgeable. And we didn't want a patient in a situation where a nurse or a doctor said, oh no, you can't take your medicine right now. You just took it 3 hours ago. Because as you and I both know, you take it as you need it. And so we've written the law in that way that it's the patient is in control.
Have you found, is it surprising or not surprising that you found so many doctors who are interested in cannabis and wish they could practice with it?
I think for doctors, and because I'm a nurse, I really focus on nurses. I think doctors have another level of concern because they have the DEA license for prescribing other medications. Nurses, on the other hand, we are free to speak to our patients about things like this. It's our First Amendment right to be able to talk to patients about their cannabis use. And we're kind of that natural bridge to be there. Now, what we are seeing is that in 2018, the National Council of State Boards of Nursing actually published guidelines for nurses. So we have guidelines. I'm not sure if doctors have as clear of guidelines as we do as nurses. And so it's really interesting to see how nurses are in a very unique position to assist patients in this way.
Wow. That is incredible. I mean, Ryan's Law, I feel ignorant that I didn't know this was happening. I feel that in some way I failed in supporting you on this. And I'm so glad you told me and us about this. I have another quick question for you. We went through COVID, and as a RN, how did you see the use of cannabis during that, what were we under lock and key for about 18 months, I believe? How did you see the use of cannabis then? Bigger, smaller, more people?
Yeah, no, we were really talking about how cannabis was essential, right? It's essential for the stress that people were under. We know through research that folks that are going through a traumatic event, if they use cannabis relatively soon after or during that traumatic event, that it can help to reduce the risk of developing post-traumatic stress disorder. Mm-hmm. And so what we were seeing were, a lot of people were home, and cannabis could be delivered to your home, and here in California. So we saw that people were using cannabis, and we felt that was good. One of the issues about nurses is that nurses, for the most part, still in 2020, were being drug tested for THC metabolites. So even though we're loud voices for patients, we're huge patient advocates, even in our professional realm, we're still limited in the ability to use this medicine for ourselves. And so one of the things we did as a network during the pandemic was we would hold what we called the weekly roundtable, and nurses from all over the country would come together and just kind of report off what were they seeing, what was happening. And so each week we would, hear from nurses in different areas. Where's the hot spot? And we tried to provide this support network so that nurses weren't out there alone, because they were really feeling worn down, underappreciated. They didn't have PPE. I mean, these things were happening that as nurses, we thought, we'll never see this in real life. And it was occurring. And so we provided this effort to give nurses that connection and that support that they needed right during the time when it was most imperative. But cannabis was definitely part of that.